All right, you know what that music means. A brand new episode of The Younger You airs tonight at 9:30 on the CW30. And Dr. Thompson, my favorite doctor, will be part of that episode. And he's talking about how plastic surgery is growing in popularity with men. Here's a sneak peek.
Discussing cosmetic surgery, most people seem to think it's only for the women. Well, guess what? This simply isn't true. You blokes make up 10% of all cosmetic procedures here in the United States, and that number is growing. Today we'll follow two men on their journey to get facelifts, right here on The Younger You. What is the difference between a male facelift and a female facelift?
The technique of the facelift is very similar, but there are a lot of factors that are different in men and women, as we all realize. And even the surgery itself, men are more likely to have bleeding problems, so we have to be aware of that, and there are just a lot of other things to consider.
I have a genetic predisposition to my eyes sagging over my eyes. My mother had to have it done as well, and so I was approved by insurance 10 years ago, but in all honesty, I didn't trust the doctor. And when I was introduced to Dr. Thompson, he made me feel so at ease that I thought, well, maybe I can get up my courage and get my eyes done, so that, because it's starting to happen to me too.
I would if I needed it for some reason, as in repair for my face.
I wouldn't.
I'm already scheduled. I've been happy with myself all these years, and now I'm 74, and I feel like this is the very last time that I can make myself look as attractive as I can.
Oh, I love her. I already have it scheduled.
This is like one of my favorite topics.
All right, well, if you saw the guy that got it done, that's actually our general manager here at Good for Utah. His name is Richard, and I remember him, Dr. Thompson, debating this procedure. How long had he thought about it?
I don't know how long he'd thought about it. I think he'd thought about his eyes for a long time, because that was starting to affect his vision. And you know, most people are thinking about this for several years before they ever come and talk to me the first time.
Now, why do you think men are so hesitant?
Well, I think, you know, it's not really, I don't think it's really been considered standard practice for men to have surgery, but there are lots of non-invasive things that we can do now, and men are bothered just as much when people tell them that they look tired or that they feel that they look grumpy or whatever, and so there's a lot that we can do to help them still look distinguished, but actually not look tired and not look angry.
Okay, like what? What are their options? What's the most common thing that men are coming in for?
The easiest thing to do is just to do a little Botox, you know, a little injection in the, you know, here where the lines start to develop, or these scowl lines, they make you look angry. It's a very easy way to, you know, just make yourself look a little bit more pleasant.
Wait, and you've had that, you've done Botox?
Yes, I've done Botox many times myself. I'm a squinter, and so I've started to get these lines and just a couple of injections and they're just gone. And so,
well, and Botox is something you really need to go to someone who knows what they're doing. I mean, you can get some bad Botox. I've been getting Botox for a few years now, and you know, you do have to go with someone like yourself who is very experienced and knows how to do it right.
Yeah, any procedure, no matter how simple it is, can create a problem if you don't really know what you're doing, so that's important. Yes.
Okay, so you have a guy sitting in front of you in your office, you talk about Botox. What's the next thing that you would suggest?
Well, there are fillers, there are Botox, and then, you know, probably we start to talk about minor surgery, sometimes laser procedures, and then a facelift would be probably considered the most involved procedure that we would do. And that's really what you have to do if you want to make a significant change, if you're looking really tired or heavy or having a heavy jowl or neck.
Is there anything you can do to prevent having to get that facelift eventually? Like, I know that when you get Botox, it prevents those wrinkles from, you know, really setting in more.
Yeah.
You know, if you were to start younger and do fillers or something, could that eventually prevent you from having to go under the knife?
Most likely, your skin and your soft tissues are going to sag no matter what, and it has a lot to do with genetics, time, and age. But it's harder to fix certain things with surgery if you haven't done anything along the way, and so it definitely helps to do these little things along the way, because then the surgery is easier to kind of give a natural result and something that's going to be, you know, not look like someone's had surgery.
Are you seeing more men in your practice?
Yes, I am.
Are the wives doing this, or are they coming in on
Sometimes they are. Sometimes they come in, they say, my wife says I look terrible, you know, I need to do this or whatever. But usually it's them, and of course I don't want to do surgery on anybody when it's not them that wants to do it. So.
Right. You have to see, Richard owns this. He really does. You have to see this episode, his before and afters tonight on The Younger You. It's on the CW30 at 9:30. You'll see Dr. Thompson there. I had a birthday yesterday. And no one knows how old I am. Thank you. It's all a mystery. 22, 16. Glenn, don't guess. Wait, stop.
Don't. 26, I thought.
Thank you.
I thought we talked
see why I love
that.
Glenn.
Hey, we are looking ahead to tomorrow on Good Things Utah. We love Disneyland around here. And tomorrow, we're giving away that Disney vacation. Troy's going to be live talking to the princesses of Frozen and announcing the winner.